My name is Martina Wood, and I'm a CPA by profession, more or less retired now. The patient voice is really important in the development of clinical trials because you want to, first of all, make sure that people who have the disease are going to find this beneficial to themselves and altruistically to all the patients that will be diagnosed in the future. So particularly in breast cancer, we've really done a good job about de-escalating the treatments. In other words, we've said, okay, a mastectomy isn't needed where a lumpectomy can be just as good. So de-escalation has been a really, really great thing. We're coming to the point where we're saying, okay, Oncotype DX, if you're lower than a score of, let's say 25, you can go into this trial and maybe you will not get what is the standard of care treatment because they're saying, well, maybe we don't need to do that because there's so many, for instance, radiation, so many side effects and late effects that can occur with radiation therapy. So do we really need to give this to all patients? However, if patients are thinking radiation therapy is what everybody gets, and I think it's important for me. So if you're designing the trial, you need to really focus on the low risk population and say, like this is, we're trying to prove really that if you're this low risk, based on a scientific assessment of your tumor markers, your genetic makeup of the tumor, then you may not need it. And then you avoid any cardiac issues in the future, the dermatitis that can occur, and other very late effects, which are other risks that they always tell you about, which scare you to bits. There are a lot of great professionals, and they are so committed to their patients and to the research and to trying to get better treatments, less onerous treatments, so that patients will continue their treatments to the end. And so it's been a really great experience to be able to pose questions that help these proposers of new trials to think about ways how the patients would look at these trials. Sooner or later, somebody in your family or your friend circle will have cancer, and you can suggest to them they look up clinical trials that might be applicable. They talk to their clinicians about what might be out there. And because we all want to be cured with the least amount of disruption to our lives and disruptions to our bodies, if it is at all possible.